Problematic alcohol use typically emerges in adolescence and is often comorbid with anxiety symptoms. Alcohol is often used to cope with anxiety and other difficult emotions and as a means of gaining peer approval, which is particularly pertinent for adolescents. There are few efficacious interventions for adolescent alcohol use, particularly targeting early stages of drinking or co-occurring anxiety and alcohol use. Improving self-compassion may be an effective intervention for adolescents with co-occurring anxiety and alcohol use. Self-compassion is a healthy way of relating to ourselves that involves treating ourselves with kindness and understanding when we're struggling, rather than responding to our distress with self-criticism and shame. There is emerging evidence for the role of self-compassion in adult substance use, but a lack of research on self-compassion in adolescents. The current study examined whether poor self-compassion predicted alcohol-related harms among young Australians seeking treatment for comorbid anxiety and alcohol use. This study examined baseline data collected as part of a randomised controlled trial examining the efficacy of the Inroads program, an internet-delivered early intervention for older adolescents in Australia targeting alcohol use, anxiety symptoms, and the interconnections between these. Participants were 123 older adolescents across Australia who self-reported anxiety symptoms and drinking alcohol at hazardous or harmful levels on the audit. The variables that significantly predicted alcohol-related harms are shown in Table 1. Significant independent variables were entered into a linear regression model to predict alcohol-related harms. Negative self-compassion score and number of drinks in the past month remain significant predictors of alcohol-related harms, but employment did not. High negative self-compassion was associated with greater alcohol-related harms among older adolescent drinkers with anxiety. These results suggest that a range of alcohol-related harms, such as interpersonal conflict, impaired control, lack of self-care, and risky behaviours, are associated with an adolescent's tendency to be self-critical and prone to shame. However, as the data are cross-sectional, it is not clear whether high negative self-compassion causes more alcohol-related harms cause high negative self-compassion, or if this relationship is bidirectional, or possibly both are caused by a third factor. It is clear nonetheless that among older adolescents with problematic alcohol use and anxiety symptoms, high negative self-compassion is a concern and is likely to be an important treatment target.